Bismillahirrahmanirrahim. Assalamu alaikum. Today we are going to study about caries. We will continue the topic from where we left in our last videos of caries. Today what we are going to discuss is which is the biggest cause of dental caries, and it is sugar. So Stephan's curve is a graph which shows how the pH of dental plaque changes with the time after eating or drinking fermentable carbohydrates such as sugar. Uh, Before eating sugar, plaque pH is relatively stable, usually around 6.5 to 7. When we take sugar inside or carbohydrate, bacteria in dental plaque rapidly metabolizes fermentable carbohydrates, and it produces organic acid, mainly lactic acid. When the acid are produced, the pH drops as acids have less pH. The plaque pH can fall very quickly, often reaching a low point within a few minutes. When the critical pH is crossed, that is 5.5 for enamel, then the environment becomes favorable for demineralization of enamel, and demineralization of enamel starts occurring then where the rescuer of enamel is saliva. Saliva gradually neutralizes the acid and clears the acid, and pH slowly rises back towards its resting level, usually over 30 minutes to 1 hour. Why is it called a curve? Because the typical graph approximately looks like this. Neutral pH, point of sugar intake, pH drops. This is a decay formation. Tooth decay occurs, and after that neutralization occurs through saliva. Now the most important point is the frequency of sugar consumption is very important. If a person eats sugary foods frequently, the plaque pH repeatedly falls below the critical level, and then there will be repeated acid attacks and prolonged demineralization and increased caries. In contrast, less frequent sugar intake will result in fewer pH drops and more time for remyelinization and lowers risk of caries. The clinical significance of Stephan curve is that it explains why frequent snacking on sugary food and drinks is more cariogenic than consuming the same amount of sugar less frequently. It also explains the protective role of saliva, because saliva buffers and neutralizes acids, clears carbohydrates from the mouth, provides calcium and phosphate, and promotes remyelinization. So, frequent sugar intake is not very good. Even if you take the same amount of sugar but you take less frequently, as you give more gap, then saliva takes its time and remyelinization occurs. For enamel, critical pH is approximately 5.5, and for dentine approximately 6.2 to 6.7. So when plaque pH remains below the critical pH, demineralization predominates, and when it rises above the critical pH, remineralization can only then occur. Rapid fall in plaque pH after carbohydrate intake and followed by gradual recovery is mainly due to salivary buffering and clearance. So, what is the pathogenesis of caries? Detailed stepwise mechanism: plaque accumulation, sugar metabolism, organic acid production, enamel dissolution, white spot lesion, cavitation, dentine invasion, and then eventually pulp involvement. First of all, what happens is plaque accumulates. Now, when after tooth cleaning, a thin acquired pellicle forms on the enamel surface. Bacteria adheres to this pellicle and form a dental biofilm. We have studied it in our last session. Now, when we take carbohydrates, particularly free sugars such as sucrose, glucose, and fructose, bacteria metabolizes them in the biofilm. Sucrose is especially important because bacteria can use it both for acid production and for formation of extracellular polysaccharides that help the biofilm become more adherent in structures. Now, after that, organic acids are formed. Cariogenic bacteria metabolizes carbohydrates, and then they produce organic acids, mainly lactic acid, acetic acid, formic acid, and other organic acids. These acids accumulate within the dental biofilm, and as a result of it, the drop in pH occurs. When the pH drops below the critical value, as we have discussed, environment becomes undersaturated with respect to enamel mineral. So mineral phase of enamel, mainly hydroxyapatite जो है, it begins to dissolve. And when it becomes to dissolve, hydroxyapatite dissolves and calcium phosphate ions जो हैं, they diffuse out of the enamel. Calcium and phosphate ions diffuse out of the enamel. Enamel starts to demineralization, and when rapid episodes of low pH occurs, the demineralization speeds up, and eventually white spot lesions occur. The earliest clinical detectable manifestation of enamel caries is usually a white spot lesion. It appears white because subsurface porosity changes the way light is scattered. Enamel surface at this stage, at the white spot lesion stage, the enamel surface may still be intact. Mineral has been lost beneath the surface, and the lesion may potentially be arrested or remineralized if the cariogenic challenge is controlled. So, the important concept is that early caries is not necessarily an irreversible cavitated lesion. Between episodes of carbohydrate consumption, plaque pH gradually returns towards normal. Saliva provides calcium, phosphorus, fluoride, buffering capacity, and it promotes mineralization. And fluoride is also important because it also promotes mineralization, and it makes the newly formed mineral more acid resistant and reduces demineralization. Therefore, we should use fluoride toothpastes. Caries will only develop when the demineralization is greater than remineralization over time. If the frequent acid attacks occur, then mineral losses progresses and it spreads into dentine. And then after dentine, it spreads into pulpal. And when the caries approaches the pulp, then the bacterial products and toxins can diffuse to dentinal tubules, and it can result in pulpal inflammation, pulp necrosis, and periapical disease, and then it becomes irreversible. Now, what are the risk factors in caries? The risk factors in caries is poor oral hygiene. If you do not brush your teeth properly, if after eating, you must rinse after eating any sugary food, or even after every meal we should always rinse. If a patient had reduced saliva due to any reason, xerostomia is reduced saliva in any diseases, due to age, due to any medication, if there are deep pits and fissures, if there are previous caries, and if a person is using orthodontic appliances, then it is necessary that you use orthodontic brushes to maintain oral hygiene. Otherwise, it will result in caries. Then dietary causes are frequent sugar intake, sticky foods, sweetened beverages, and night feeding. We should never sleep without brushing our teeth, because at night the saliva is less and bacteria accumulates. Then inadequate brushing, irregular dental visits, tobacco, and alcohol. It also affects the oral hygiene and eventually leads to caries. Then medical conditions such as xerostomia, dry mouth, diabetes, GERD, radiation therapy, and Sjogren syndrome, in which also xerostomia occurs, they can result in less saliva production and eventually more caries. We will discuss the other topics of caries in inshallah next lesson. Today we will finish till here. Jazakallah khairan kaseera. Assalamu alaikum wa rahmatullahi wa barakatuh.